now, if you have your practice exams, you have one there? All right, do you see a question about erythropoietin on there? You see one down there about this particular, it is on one of your, on one of them. Which one is it?
2.
What does number 2 say? What now? Excuse me. Erythropoiesis.
They found that hemoglobin production begins in which one of the following stages? That one?
Oh no, that's the one where hemoglobin production begins in the early erythroblast.
The one
That's what we just taught. Well, you'll find there'll be one on the test about erythropoiesis.
Yeah.
There is one somewhere.
Yeah, the hormone produced by the kidney.
There you go.
And then number 9, it says, which one of the following is a key factor in dictating the production and release of the hormone?
Okay, that's going to be. You have something that says low oxygen content, high altitude.
O2 level.
Oh, decrease in O2 levels. Yeah, decrease in O2. That's what you would have. That's what you have in the upper altitudes. You see something like that?
Well, it just says O2 level,
Oh, okay. Yeah.
so just oxygen level.
Yeah, O2 levels. That would be a key factor. Key factor, O2 levels. If the O2 level is low, boom, it goes up. Erythropoietin goes up. Okay. All right, so there's that one right there. Now here's kind of a deal right here. Look at this. Decreased oxygen. This is out of the book by C.D. Stevenson, Tate, I believe. There it is. Decreased blood oxygen, kidneys, increased erythropoietin, bone marrow, increased blood cell production, increased blood oxygen. That's the scenario. That is the scenario of that one. Yeah, that's it. And remember, your aerobics will also cause this. Aerobic conditioning will cause this to a certain degree. Your blood cell count will go up some. It really will. Okay. And so that's good for you. That's good for you. More oxygen carrying capacity to your brain. That's good. Okay. That's good. Good for the system. Okay. Any questions over that? That'll be on your test. Just bleed on that. Something like that's going to be on the test. It will be there. The erythropoiesis. All right. Now this next slide, everybody. This next slide right here just says reticulocytes. And remember I said a while ago, the reticulocyte has ER in there, the endoplasmic reticulum. It's the step before the mature red blood cell. Now they'll do in hematology. I've never seen that on one of my charts. Reticulocytes count. I guess they pay attention to that sometimes. I don't know. They're full in hematology, and we don't have anybody in hematology here. But it is in the literature that if it's less than 0.5% of the number of mature red blood cells, then erythropoiesis is too slow. Low count may confirm a diagnosis of pernicious or nutritional anemia. Also may indicate kidney disease. This is another thing, kidney disease, which prevents the kidney cells from producing erythropoietin. And whether or not the kidney cells then do actually produce erythropoietin, we're just going to leave it at that because that's what you'll just leave it right there. That's a hormone. Just say it's produced by the kidneys trigger this. They trigger the increase in the erythropoietin. Low oxygen content of the kidney. The kidneys are the sensors. Kidneys are the sensors. Now you and I want our kidneys. Now this is another thing we wonder about. I wonder, I guess if a person gets a kidney transplant, the transplanted kidney, I suppose, I have to ask Dr. Joe Galati that sometime. He's real into, but that's his liver transplants. And a kidney transplant, you get a transplanted kidney. Does the transplanted kidney, it's okay, it's good tissue? I guess it responds. I guess the transplanted kidney, I guess, will respond to low oxygen content, or is there a backup mechanism? And that's a good question right there. That's a good question we might look into sometime on that. But anyway, also kidney disease. Kidney disease is not good. Hey y'all, what do you think is the number one cause of kidney disease? If you were to say, starts with an H, hypertension. High blood pressure is the number one cause of kidney disease. You didn't know that. Hypertension will wreck the kidneys. Number one cause, prolonged hypertension. Yes, hypertension. Oh yeah. And so keep that one in mind. All right, now, dietary factors that affect red. I have a question on that too, y'all. There's a question on that, on this one in the practice exam. There's a question on this. Vitamin B12. I have which one? I have a deal on your practice exam. If you look it up there, you'll have one. Which one of the following is not a factor in the production of red blood cells. Iron is, vitamin K is, folic acid is. I'm sorry, vitamin K is not. I'm sorry. Iron is, folic acid is, vitamin B12 is, but vitamin K, now vitamin K causes the liver to produce prothrombin. Prothrombin is a clotting protein. It's absolutely necessary in the clotting of blood, but not in the manufacture of blood cells. Now, let me show you. Folic acid absorbed in the small intestine, DNA, iron absorbed from the small intestine, also converted when RBC, also conserved when RBCs, which we'll go over that later. Necessary for the synthesis of hemoglobin. All right, so on that practice exam question, do you have that practice exam question with you? What does it say? Which one of the following is not required for the blood? All right, now notice I have iron, I have folic acid, I have vitamin B12, and I have, as another choice on there, vitamin K, and another choice says all of these. All right, so the one that fits the bill there is vitamin K. Not necessarily in the production of red blood cell, but the vitamin K triggers the production of protein. If you are low in vitamin K, your blood won't clot like it should. If your vitamin K levels are low, you won't get, your clotting won't be up. I've heard stories of like women that are getting ready to have a baby, that many times the OB/GYN, the doctor will up the vitamin K. And if they ever increase your vitamin K, say, we want you to take more vitamin K. It's not to make your body produce more red blood cells, but the vitamin K is to give you more prothrombin. And prothrombin is absolutely necessary. In other words, which we'll get to in blood clotting, but prothrombin is absolutely necessary in blood clotting. Prothrombin has to be converted to thrombin, and thrombin has to convert fibrinogen to fibrin and blood clots. But that's later.